Hey guys, Davin Lim, board certified dermatologist. From the thumbnail you can see that today's topic covers a common condition. This is experienced by many viewers, yes, dreaded hair loss. For those of you who know me and this channel, you will see that the sponsored content only accounts for less than 1% of my total content. And I only do content in what I firmly believe in. Well, today's video is sponsored by iRestore. iRestore provides low-level laser therapy for hair loss. As you guys know, my thoughts and opinions are 100% my own. But most importantly, this video is based upon scientific evidence, namely what is out in the literature. So today I'll be discussing hair loss in general, but how dermatologists approach hair loss. But I'll be concentrating primarily on low laser light therapy, or LLLT. And I'll be primarily talking about iRestore Pro, basically the sponsors of this particular video. I'm currently trying this device for my hair loss. I have been on topical minoxidil. However, I'm not keen on PRP injections because I hate injections. And as you know, it is a bit of a hassle for PRP, and hence I've opted for low-level laser therapy. So it's been shown by many studies that 2 or more treatment modalities are best if you suffer from pattern hair loss. So I've been on minoxidil for years, but my aim is to grow my own hair. In particular, to increase the thickness of hair, but also the volume of hair. So minoxidil has been with us for many, many years, and I do believe that this combination of minoxidil plus low-level laser therapy, as in iRestore, will provide a better outcome than either treatment itself. And I'm not too keen on tablets, so that's why I prefer topical preparations such as minoxidil. So what is the iRestore Pro? It's the only device on the market to combine 382 lasers and light-emitting diodes. This provides the correct power levels to stimulate your hair follicles. So iRestore is FDA cleared, and believe it or not guys, it comes with a 12-month money-back guarantee. So it's very, very unusual for a company to actually offer a money-back guarantee. So that way, I guess you have your peace of mind that this particular device will do what it says it does, which is basically to regrow your own hair. So if you check out the ratings, it is right up there with a very high patient satisfaction rate. So let's talk about lasers and light emitting diodes. Why do we combine lasers and why do we combine LEDs in the same treatment? So lasers offer the depth of coverage, hence the ability to penetrate into scalp through more dense areas of hair. So laser, basically you can think of it as penetrating dense laser hair to reduce hair fall, future hair fall in these areas, while light-emitting diodes give the breadth of coverage while still penetrating deep enough for the follicles. Hence, in thinner areas, the follicles will be receiving both laser and LEDs. And in thicker areas, it is laser therapy. So guys, just to be wary, there are many causes of hair loss, but today I will only talk about male and female pattern hair loss. This is known as androgenetic alopecia, and it's super common. It affects 50% of men and at least 1/3 of women. So how do dermatologists approach male and female pattern hair loss? What do we do? What do we treat them with? Traditionally, it's been lotions and drugs. And there's been a significant shift in the paradigm on how we manage things. Because when you look at the literature over the 5 to 10 years, you'll see that adjunctive procedures, we talked about platelet-rich plasma, and this particular treatment, which is low-level laser light therapy. So the foundation of treatment still remains, even though we have new drugs or new methods. Basically, we still want to slow down hair loss, and that's why I prefer minoxidil topically. So look for a 5% formulation. It's once to twice a day to areas which are thinning and areas that you want to preserve. So minoxidil increases the number of hairs in the growth phase. Your dermatologist may trial you on hormone enzyme blockers, such as finasteride or dutasteride in males, and also anti-hormones such as spironolactone in females. Most dermatologists will pair at least 2 or more treatments based upon slowing down your hair loss and secondly, increasing hair growth. And this is where low-level laser therapy comes in. So what can lasers do for hair loss and how do they actually work? Believe it or not, this whole thing started with a hairy mouse. Experiments in the 1960s using ruby lasers in mice showed that there's an interesting side effect, mainly hair growth. So fast forward to today and you can have the efficacy and safety of laser devices basically in the convenience of your own home. So in the context of laser and hair growth, what does the evidence show? What is it that works and where does it work at? So when we look at the scientific literature, there are three main types of laser devices that can be used for hair loss. First of all, ablative fractional laser resurfacing. So it's something like a CO2 laser. Secondly, non-ablative lasers such as diode or thulium-1927. So that's like your Fraxel type devices. And thirdly, the low-level laser therapy, which is what I'll be talking about today. Now, fractional lasers work by increasing the delivery of actives, but at the same time stimulating stem cells. The downside about these particular lasers, so we talk about the ablative CO2 and the non-ablative thulium laser, is that this treatment has to be done in clinic. So there's associated costs, associated recovery time, and associated consumables. So when you add all this up to 6 to 8 sessions over 1 year, the costs are significant. And the other thing as well, they're not permanent. Flip side, however, if you have low-level light therapy using a device, it is not only more effective, it's also more cost-effective. The great thing is that it's got no recovery time. So you can do it conveniently in your own home, and you've got zero recovery compared to the lasers that we use in clinic. So iRestore is super comfortable, it's super convenient. It takes about 25 minutes to perform, and you can do this while you're doing other tasks. So not all devices are created equally, but more on that later. So what is the science behind low-level laser therapy? Low-level light therapy or laser therapy is just like watering plants. Hair is either in the process of growing, resting, or falling out. The light energy acts like water and nutrients and absorbed by your own hair follicles to keep your hair in the growing phase. A scientific explanation is that low-level laser therapy modulates nitric oxide in mitochondrial metabolism, increasing cellular metabolism. Basically, low-level light therapy awakens your resting hair follicles, causing them to grow. So over time, your hair shaft will be stronger as laser therapy increases the diameter of your hair shaft, but also increases the robustness of hair follicles, in turn reducing hair shedding. Additionally, due to the increase in growing phase or anagen, hair remains on the scalp for a lot longer. So who will benefit from low-level laser therapy? So it's for patients who suffer from male or female pattern hair loss, and we call this androgenetic alopecia, which is genetically mediated. Like all other therapies, including topicals, tablets, procedures such as PRP and microneedling, the earlier you treat hair loss, the better the results. So from a scientific point of view, any non-surgical method works best when the hair shaft diameter is more than 50% of the original diameter of the shaft. This holds most of the hair in compared to trying to stimulate hair follicles when the diameter is less than 50%. So once it's less than 50%, generally speaking, most of us agree that it is basically to the point of no return. So no matter what treatment you want to use, treating your hair loss earlier means a better outcome. In scientific studies, low-level laser therapy has a response rate of up to 80%. By definition, a good response means cessation of hair loss and/or increased hair density. In the context of regrowth, the average range between 30 to 50% depending on the studies. So what are the limitations of laser therapy for hair growth? So what are the limitations of low-level laser therapy devices? Realistic results are super important to understand. There are no non-surgical treatments that will provide regrowth to bald scalp. Remember that. So remember that all non-surgical treatments work best if the hair shaft diameter is more than 50% of the original. Again, I stress again, the earlier you treat, the better the outcome. So what about the type of hair loss? What about the type of hair loss? So I've breezed through this quickly before, but laser therapy is best for male and female pattern hair loss. There is some evidence that hair loss coming from things like alopecia areata and rare scarring conditions like lichen planopilaris can benefit. But these forms of hair loss are more complex and should ideally be managed by your dermatologist. So guys, you'd like to know the safety aspects of this treatment. This treatment is super safe, however there's some possible theoretical side effects. They include what's known as possible telogen effluvium. Telogen effluvium occurs when there's a transition from your resting hair phase to your growing hair phase. This means that some people may experience a brief loss of hair lasting no more than 4 to 6 weeks. It occurs with many treatments, including PRP as well as minoxidil. So be wary of this. Essentially, this phenomenon eliminates the weaker hairs so that the stronger hairs can take over and regrow. So don't worry if this happens to you, it's actually a good sign. So rarely scalp irritation can ensure, again, this is mild and this is transient. The process behind this is thought to be increased blood flow to the scalp, and if it happens to you, consider it as normal and good. So let's explore the concept of synergy. Laser hair therapy can be used in conjunction with topical treatments. So we mentioned topical minoxidil. If you guys are trying to find minoxidil, my suggestion is find a 5% solution. Generally speaking, the foam is better than the liquid. The foam contains less added chemicals, including propylene glycol. Now look between, like I said, between a 3 to 5%. If you're trying to go for 2%, probably not a good idea because most of the studies compare minoxidil at a 5%. Your dermatologist can talk about oral minoxidil, however there are potentially bad side effects such as edema and ankle swelling. So I always prescribe foam or lotions. So you can also have topical finasteride, which is a blocker of the hormone or enzyme which produces hair loss. It is also used as adjunctive treatments for more traditional medications such as finasteride or dutasteride in males and anti-androgens such as spironolactone in females. So remember guys, by combining iRestore with traditional methods, your response rate is a lot higher. You can also use this with PRP to help promote and maximize hair growth and to maintain the health of new hair. In the context of hair restoration surgery, most surgeons actually prescribe low-level light therapy. They prescribe it pre and post hair transplant as it reduces hair fall and accelerates growth of hair transplantations. With the iRestore system, the guidelines are 25 minutes 3 times a week. Generally, results are seen in 3 to 6 months. However, individual results may vary. So how easy is iRestore to use? Ease of use is one of the most important factors that govern success. We know that iRestore is super easy to use. It's a plug and play device. Simply plug it in, turn it on. There's a timer there for 25 minutes and it does the rest. It is recommended that the treatment interval, like I said, is every second day or 3 times a week. Clinicians have found that one of the most important aspects of any home device is actual compliance. In other words, you may have the device, but to actually use it is a different thing. So studies have shown that helmets such as iRestore have the highest compliance as compared with combs and hair wands. So unlike other handheld devices, you can use iRestore in a hands-free situation. So you can multitask while getting treatments done. This means you're more than likely to comply with the frequency and the duration of treatment, which is super important to give you results. So for me, I've got a habit of iRestoring my hair basically 3 times a week. And I do it during my video editing time, which means this way I'm not wasting time and getting the maximum benefits of both hair growth, but also my efficiency of doing work. So don't worry if you miss a day or even a week, your hair won't fall out. Having said that, consistency is the absolute key. So seriously, once you get in the habit of doing things, you won't even know that the device is on. So guys, I hope you like this content of my video. I'll personally document my journey as I've just started using iRestore. Hang tight over the next few weeks or few months. I can tell you this anecdotally first, is that I'm experiencing less hair fall in the last couple of weeks. And basically, I'm pretty stoked with this device. So for now, you can check out the link below to learn more about the iRestore laser. The company has given you guys an exclusive $400 off with my code Dr. Davin. Go to the iRestore website and take advantage of this exclusive offer. This is a great time to save, and literally it's an investment for your hair. It's pretty cool that they give a 12-month money-back guarantee. But guys, I'm wanting to know, for all you guys wanting to know about the science behind laser therapy and hair loss, go to Google Scholar and see for yourselves. And this is why I really believe that this is a groundbreaking treatment for hair loss. Catch you in the next video.